and I'm the President of the Parents Association. It's my pleasure to welcome you here this evening on behalf of the committee, and my great honour to introduce Casey, who is amazing. Her reputation definitely precedes her. She has done a lot of work with members of our community before, and hence why she's been flagged to us to come and speak to us today. The session is being recorded as well. We'll send you guys the links to everything that Casey's going to talk about tonight as well. So, and we'll send it to Romy so you can share with the staff as well. Awesome. Without further ado, thank you very much.
All right, so thank you for coming in this evening. I really appreciate it. We're going to talk about what is occupational therapy this evening. And I know that I've presented to some of you before, so you understand, but we're going to run through it in a little bit more detail today. But first, I'm going to tell you a bit about myself. So I've been a pediatric OT for 16 years now. I did my training in Sydney, Australia, which is where I'm from. So I worked a few years there. The majority of my career has been spent here in Singapore, so I've been here for about 12 years now, and I did a couple of years in the UK as well. I've always worked in pediatrics, mainly in private practice, but also some school-based positions as well. In terms of like postgraduate training, I have training in what's called self-regulation, which I'll go through a little bit further in this, I was going to say assessment, presentation, play, what's called sensory integration and accessibility as well. I also have an MBA in marketing, which I got for healthcare design and communication, so this is another area that I'm interested in as well. And for me, in terms of like my philosophy for, intervention, I work really closely with families. So today we're looking at the age range from 2 to 6 years. For me, I don't treat a child without a parent in the session. So that means assessment and also sessions as well, because, a young child that's, 2, 3, 4, 5 or 6 years old can't walk out to a parent and say, hey, guess what I did today? They will say, hey, guess what I went on the slide, but they'll miss out all the other important things. I also like to work very closely with educators as well. So I do come on site here fairly regularly to do classroom visits. I have email contact, and which is very flattering. The teachers still remember me here as well, so that's good. So I really do enjoy it. In terms of what we're going to go through today, we have a bit of an introduction activity, just to get a feel for why we would need occupational therapy. I'll run through what occupational therapy is and the pediatric side of things. We'll look at why early intervention is important for the 2 to 6 years range. And one of the questions that has come up a lot recently is, how is COVID affecting child development? Okay, and then I'll leave some time at the end for questions. So what we're going to do is we're going to jump into the activity. Does somebody have the paper and the pencils? They are behind here. Okay. So can I just get you to take a pencil? I apologize that you don't have anything to lean on. And just a piece of paper. Okay. Actually, can I just grab one of the pencils? Thanks. Yeah, just need one. All right, so first thing I want you to do is hold your pencil in your non-dominant hand, okay? I also want you to try and use a tripod grip like this, okay? So the 3 fingers on. Then I'd like you to write your name. Okay, everyone done? Now I'd like you to write this sentence for me. I can already see people are like, this is a little bit tough. Okay. Is everyone done? Yeah? All right. So in terms of effort, how much effort did you have to put into writing then? A lot? Yeah? Yep. Quite a bit more than you usually would? Yep. So what if I said to you that maybe we should just try and practice some more? And then I gave you this sentence. And I love the looks on your faces, because this is what a child will experience in the classroom. Okay, so if they're having a lot of trouble with writing, if they're putting in the amount of effort that you just did, and they're asked to do this every day, this is how they're going to feel. And that's the emotional reaction that comes with the activity. For you guys, was it easy to keep that tripod grasp, or did you find your hand was like slipping a little bit? Or the pencil was hard to hold on to at all?
Hard to control.
Hard to control, yep. Was there like a bit of lack of stability there? Yep. So these are the things that some of the children that I see can experience in the classroom. Now, obviously a 2-year-old, we're not expecting them to write, but they start to develop pencil skills at 18 months of age, which is grabbing onto a pencil with a palmar grasp and starting to scribble. So if they're not starting to do that at that age, then we have a problem. So I just said to you, right, let's do some more practice, and you all went, oh. Do you think it would help to do more practice? Like significantly, or do you think the challenge is a little bit too high?
I suppose if you kept doing it, you would get better.
You would get better to a certain extent, but if you think about how you write with your right hand versus left, how much effort you're putting into it, yeah, it's gonna have a bit of like a limited effect, right? Because when you guys are using your non-dominant hand, it changes the biomechanics of how your hand and your arm are working. So do you think you could write like this, right, or write this amount of, do you think you could write with this amount of effort every day in the classroom? No. So if you're a student and you had to do some things in the classroom and they felt that challenging, from your perspective as a student, would you want some help? Yeah, okay. And this is where OT comes in. So teachers are great, they'll teach us a skill, they'll give us more practice, but sometimes if we see that a skill is getting stagnant, that's when they're calling in an OT to help, because we're trained to really drill down on the activity and figure out the other components that are not working so well, okay? So this is what it is that we do. All right, so we'll dive into what occupational therapy is. Now, if you look up occupational therapy on the internet, you're going to get these big, technical, horrible medical definitions, okay? I'm not even going to read through this because it's way too technical. So for occupational therapy, there's 3 key takeaways, okay? So first of all, we help people overcome challenges. So they might be physical. So if you think about what you're doing then, it was really hard to hold the pencil and stabilize it, okay? Cognitive, so you guys understood what you needed to do then for the task, but somebody else might not. Or they might have trouble focusing because the physical part is so hard, and that has the knock-on effect that it will affect the focus. Emotional, so like we discussed, if you had to do that task every single day at school, you wouldn't be jumping for joy, you'd be kind of stepping back, right? And going, I'm a bit frustrated, or I might be getting a bit anxious about it. And kids anticipate this because when we do a task, we have an emotional attachment to it. Okay, so the teacher might not have even explained the task. They'll just go, we're going to do writing, and then suddenly a kid is like under the chair, you know, hiding because they don't want to do it because it's too hard at this point. Through occupational therapy, people can participate in tasks that they need to do or they want to do. Now, in this case, you need to be able to write to go to school. You need to be able to do it to participate in your lessons. So you'd have like writer's workshop, the literacy lessons, do you do UOI? Yep. Even with the younger kids, it might not be writing, it would be drawing. And the drawing is a precursor to writing. So if we're having fine motor difficulties or biomechanical difficulties with a pencil, we get kids that are not drawing as much as they should be as well. And that's an important skill because it actually leads into higher order literacy skills. Okay? People are happier and more satisfied when they achieve goals because their life is more fulfilling. So if you went into school each day and you were really struggling with writing or drawing, maybe, you know, your muscles here, your core isn't strong enough, so then sitting on the floor is harder. And if you do that, your head position drops down, it changes how your auditory canals are working, and my visual attention is down. So I'm going to miss pieces of information. you know? It might be that getting around an obstacle course in PE is hard, and I can see that all of my friends can do it. So if you're going to school each day and you're experiencing a certain amount of failure, your attachment to school is going to change as well. Okay, and so with OTs, we take a very functional approach. As we said, we find tasks that kids are having trouble with, and we want to find out why that is, and then we want to help them. Okay, so occupational therapists are what we call allied health professionals. We're on the same sort of level as a speech therapist and a physiotherapist as well. Okay. We work in a range of environments, and I think this is where it gets confusing, because in certain countries we work a lot in schools. In Australia, where I'm from, they have the OC Rehab, so they work in offices, a lot in hospitals, and a lot in outpatient clinics. But if you look at most countries, it's mostly the hospital and outpatient clinics. So when you say your child needs to go to OT, and you look it up on the internet, and there's this huge technical definition, and the parent's like, why do I need OT? You know? And this is why. So this is why I also think that it's good to encourage parents to contact an OT and have a conversation with them as well about what the needs are and what we do. We do need to conduct assessments, and I'll go through that a little bit later as to the reason why. We provide what's called functional intervention, which means that we want the intervention to improve the task or the skill that the child is having difficulty with. We do not provide a diagnosis. So if a child is referred to us for OT, we might flag that there's some fine motor difficulties or gross motor, or maybe there's difficulties with focus, but you will not walk out with a diagnosis. That's done in conjunction with another healthcare professional. I myself prefer to work with children for a period of time, have feedback from teachers and parents as well before we would recommend going for a further assessment. And the roles vary across different cultures as well, which I kind of already touched on. So this is how OTs look at activities. So when you tell me my child has difficulty with writing or drawing or riding a bike, my mind automatically goes to this very complex visual thing over here. And what I start looking at is, okay, the person. So in this case, it would be the child. For example, with the handwriting that you just did, I would go, okay, you're having trouble with the fine motor and what we call the biomechanics of the arm. Yeah, so that's causing an issue with writing. The task, was it too hard? You could manage the I can jump, but when I said, hey, let's write the quick brown fox jumps over the lazy dog, you all went, oh no, that's a bit hard, can't do that. And then the environment, we're actually in a school. So the environmental context is we need to be able to do this task in the school. We need to look at the environment, can a child are they overwhelmed by being in a classroom with 20 kids? Or is that okay for them? Because that would affect something like focus as well. So we're not always assessing the child and just looking at them. We have to look at how these three pieces of information interact together. So this is, as I said, this is what goes on in an OT's mind. In terms of international roles, we're governed by what we call the World Federation of Occupational Therapists. Now, at the moment, we're in the Australian school. They have quite an inclusive policy, which is great. Countries such as Great Britain and America also commonly have occupational therapists in the school settings. Singapore has actually just brought it in the early years. So they now have, I don't know what they call them, but they've got special needs people that come in and they're monitoring the child's development. Because what they've found is if they start to do that from an early age, they can start to pick up some of the developmental red flags and try and fill those in. So we're now kind of branching into this area. It's not across the whole world. OT is underdeveloped in certain countries like Malaysia, Cambodia, and Vietnam. So when the borders are open, we do get quite a lot of kids coming in. So I've got a child who's just started driving over from JB every week to come for OT, which is, it's nice. But it was also nice getting kids coming in from Cambodia and Vietnam, and so being able to give them the treatment that they need, but also teach the families as well. OT is also very well developed in some countries such as Japan, but they have a very small percentage that work in developmental pediatrics. And so I guess when people, like we make an OT referral, sometimes it doesn't make sense because the context of the country of origin is different. And as I said, there's the 3 kind of countries here, and if I did more research, I'd probably find more where OTs are really kind of embedded in schools now. But not only embedded in schools, it's not just like schools with special needs, it's schools like the AIS that have a really positive inclusion policy as well. Okay, any questions so far? No? So we'll dive into pediatric OT. So I found this really good video, so I thought I'd give you a break from listening to me, and explains pediatric OT quite well. So do I have to click it on here? On here? There we go.
What is pediatric occupational therapy? Isn't occupational therapy for adults? Since they have occupations? Actually, children do have occupations. They include reaching developmental milestones, play, self-care, things like eating, sleeping, dressing, grooming, and bathing, and academic tasks. Handwriting, fine motor skills, focusing attention, and socializing. That's where a pediatric occupational therapist can help, or OT. Occupational therapy is concerned with promoting independence in activities of everyday life or occupations. Pediatric OTs work with babies, very young children, and school-age children in collaboration with the child's family, teachers, and other health professionals. Pediatric OT can benefit children who fall into several categories, from premature infants to kids with ADHD to children struggling to read or write. What areas can pediatric occupational therapy address? Cognitive skills, remembering letters, shapes, and sequences. Fine motor skills, finger dexterity, wrist and forearm control, and hand strength. Gross motor skills, balance and body coordination. Self-care tasks, dressing, bathing, and self-feeding. Social skills, taking turns, listening, and following directions. Emotion regulation, helping kids understand and process emotions. Sensory processing, receiving and responding to information that comes in through the senses. During an initial visit, an OT will evaluate a child's strengths, as well as difficulties, in critical developmental areas, and design interventions that promote the healthy development of skills needed for success with daily activities. Through meaningful activities and play, OT facilitates the development of age-appropriate skills. These foundational skills allow for the development of self-confidence in children to help them play, learn, and grow. When skill and strength cannot be developed or improved, occupational therapy offers creative solutions and alternatives for carrying out daily activities.
Okay, so this video gives a really good overview of what we do. As you can see, like we kind of joke that we're a jack of all trades. And so when we get a referral, we need to look at the task. And as I said, we need to break that down. So I'm going to give you an example of how we do this. And the reason I've used drawing is pretty much everyone here is able to draw. So we all have a good background knowledge of what that involves. So the first thing that we need to do is observation. So from this picture here of this girl drawing, you might pick up a couple of things, like maybe her pencil grip looks a bit awkward. But for me, I can see that her shoulders are actually elevated, right? So her shoulders are up like this. I can see her arms are a little bit abducted. And when I do this, I'm like, oh, actually, this is not the most comfortable position for me to be in. If I look at her wrist, it's actually in extension like this because she has this lateral grip going on. Now, if I've pulled my wrist into extension like this, I cannot operate my fingers, which means I'm starting to work from the back of my hand. If my arms are out like this and my shoulders are elevated, I'm also over-recruiting in these areas as well. Now, with girls, they can be a little bit deceiving sometimes because they really like to draw and they tend to push themselves because of the social aspect of things. If you look at the way her mouth is, normally when kids are concentrating, it's a little bit more like this. Okay, so she is working quite hard. With her grip, because it's kind of come over the top of the pencil like this and it's not on top, it looks like she has what we call poor tactile discrimination. Okay, and what that means is that when she goes to write, rather than feeling the letter direction in her fingers, she's going to be using the back of her hand. And that can cause issues with where do I start, which sequences do I follow, because she's not getting enough information for her body to make sense of how to form the letters. In terms of ergonomic needs, for me, she'd need a slope board because I'd want to correct that wrist position, and I'd also want to give her a thicker mechanical pencil to hold on to as well. So from these pictures, this is kind of my assessment so far, but obviously in real life I would run proper assessment where I would sit with the child. Yep.
In this case, do you interrupt?
Interrupt, or do I?
Do you tell her to stop and then fix the form?
Yeah, we'd have to give her some like exercises to strengthen up her shoulders because the bigger muscles of the body develop first. And then, as I said, if I give her a slope board, then I can actually support the shoulder, arm, and wrist, and she'll naturally start to get build like some more strength and stability through using that slope board as well. So yeah, I would intervene, but I would also do it in a way that's like as natural as possible and through play as well. And the reason is that even though she might be interested in drawing now, it could be that when she comes to write, and this is a different set of skills, it could be that she ends up with pain as she gets older, or she ends up with poor fine motor control as she writes as well. Okay, so these are the things I can see from this picture, but I also have areas that I would need to make further assessment for as well, that I can't tell by looking at this picture. So I would be thinking about the cognitive aspects. So are the motor weaknesses that I'm seeing affecting her focus? And so what happens is if the fine motor skills are weak and we're putting a lot of effort into it, it means that the complexity of the task may be less. So if I'm concentrating so much on trying to get this done, her drawing may lack a lot of details, or she might just want to get it over and done with as quickly as possible. Okay? In terms of intrapersonal skills, so what's my, kind of relationship with myself about this task? Does she have good self-confidence, and is she actually enjoying it as well? In terms of interpersonal, what often happens is we can get frustrated with other people, and I think we all do it as well, when we're having trouble with a task, and it might be a peer does something to set us off, or a teacher wants us to transition when we're not ready, and that's when kids can do things like get frustrated, okay? And then maybe lash out a little bit as well. So these are the other areas that I would want to further assess. Okay, so when teachers make an OT referral, it is usually because there are challenges with performing a task or a skill. Okay, and so what the teacher is seeing that is within the functional context of the classroom, that this child is having a little bit more trouble with this particular task or skill. Now, we definitely recognize that developmental milestones, there is a leeway for them. What we also need to look at is the environmental fit, and then sometimes the curriculum as well, because depending on sometimes the age. So sometimes I get referrals for children who are at the cutoff stage, and so they're kind of 12 months almost behind with their motor skills. If that area is a little bit weak, they might just need some help to bump that up. Another common referral is when kids switch curriculums. And so sometimes there might be more handwriting heavy at this school, but then at the last school they may not have done that type of work. So doing a few sessions can help. Often the teachers are looking out for is the difficulties with drawing, handwriting. Self-care skills is an important one, so toileting, feeding, like opening packets, taking off shoes and socks. Gross or fine motor skills. Sensory processing, which is the way that our body processes sensory information, and that can affect a child if they need like more movement, then they can get up and move around at a time that would be unexpected in the classroom, which then has the knock-on effect that it affects their focus as well. In terms of the reason, it's usually things like a lack of independence that's expected for that particular age group. And we do take that into account during the assessment as well. If they're reluctant or unable to perform a skill, and as I said, I've worked with kids where they've said, oh, right, we're going to do writing, and the kid's like straight under the table or has walked out of the classroom. And sometimes we think, oh, that's a behavioral response. Yes, it is, but it's usually because there's some underlying challenge underneath that we need to have a look at. Emotional regulation, so as I said, we can take things out on other people and get frustrated. Sometimes kids can get anxious as well. Or sometimes, kids will be in the playground, they get like too overexcited and too stimulated Okay, and then that can quickly turn to frustration and things like physically lashing out. Or they could be at the risk of developing a learning difficulty. So if I don't participate in a task, then I'm not practicing. Okay, so if we have kids that are, say, like not drawing at a very young age, then they're not going to build up the complexity of skills that they need to draw more. And by the time they get to year 1 and they say, hey, can you draw a picture and write about it? If that picture doesn't have a lot of detail in it, it lacks language. And then when the kids look at it, there's not a lot for them to write about. If they have weakness in drawing, there's probably going to be a weakness in the handwriting as well. Again, mainly with the writing, if there's a lack of practice, we don't develop things like more complex punctuation as we get older and spelling. Even things like if I avoid doing motor tasks, in the classroom I have to be able to sit and hold a stationary position quite a lot. And so if my muscles are not well developed enough here, our big muscles develop first, it's going to have the knock-on effect that it's going to affect the development of the arm and the fine motor muscles too. And so this is where the motor path comes in as being quite important. Okay? And I think, when teachers are making that referral, from my experience, it's often due to empathy. Like they want to be able to help the child. I think particularly here, they try and put strategies in beforehand, like because they've got a big learning support department. And, so normally when I am contacted, they'll say, oh, we've tried X, Y, and Z, and it hasn't worked. And therefore, we're calling you in because what we're doing isn't enough to support this child, not from a negative point of view, but because they want them to succeed in the classroom. Okay. All right. So OT assessments. Now, this can be like a little bit of a sticking point. It is hard to sort of say to a parent, I'm really sorry, but we have to do an assessment. And it's partially because we're mandated to. We're a regulated profession. Okay? But the advantage of that is that we get a really good snapshot of the child's strengths and weaknesses. Now, without that, I would be guessing about what I'm treating. So then that's not fair on the child, because I could be doing the wrong thing. Definitely not fair on the parent and the educator, but also definitely not fair on a parent's bank balance as well, because I'm not providing the most direct services for them. When we do this, we do consider the needs and wants of the family and the educational setting. So sometimes parents will say, not really interested in having intervention at home. I feel like everything is fine, but I'd like you to focus more on school. I'm like, okay, we can do that. Or sometimes it's vice versa. It provides the basis for goal setting, which is really important because, it's like anything we do in life. We want to work towards targets and we want to track them. And if we do that, that means that the child will spend less time in intervention. You'll be aware of what's going on. You can track and monitor as well, and hopefully the teachers can too. Okay? In terms of the methods, what we do is there's an observation, so we can use things like developmental checklists. And for kids who are, say, 2 to 3 years old, I don't really do standardized assessments. And the reason is that the child comes in, they need to have a relationship with me. A 2 or 3-year-old's not going to do that. I always have a parent in on the session as well, which I think is quite important for their comfort level. But if I give an instruction once and the child is not able to do it, I have to mark down that they can't. But then maybe in 2 weeks' time, once they're more familiar with me, they might. And so I'm not keen on putting that down on paper. So with that age range, I tend not to, and also some 4-year-olds as well. I do like to work with teachers and get some information from them. And quite often with the ELV, I'll come in and do a classroom observation as well before I meet the child, because that gives me the opportunity to see them in their natural environment, and a home visit as well, if the parent would like. Sometimes we do need to do standardized assessments, okay, as the kids get a little bit older, because there might be some pre-writing skills that are lacking, there might be some motor skills that are lacking as well, and we kind of want to pick up which areas those are. With things like motor skills, we always think, oh, it's just the locomotion, it's just the balance. But you've got like eye-hand coordination, projected action sequences, upper limb stability. So there's quite a variety of things that I need to test on that. And sometimes it's specific areas, and then sometimes it's overall that I need to work on. So I really need this information to be able to do the best for my client, and then for the family and for the educators as well. In terms of the process, for me, personally, I have a consultation with parents first. So I meet with them for an hour without the child being present because we need to have an open conversation, and I don't like talking in front of kids. I think it's really important that we go through all the developmental history, what's gone on at school, what's gone on at home. Quite often, particularly at the moment, there's been a lot of movement with COVID and things like that, and I need to take that into consideration as well. Then we would do the assessment session or the classroom observation, and then I meet with the family again to do a feedback session, and I give them a written report. Okay, so I do try and make the process as comprehensive as possible, and I invite parents to come and ask me questions at any point. In terms of the assessment, as I said, I do prefer that a parent is sitting in on that session from 2 to 6 years of age. I think just because not all kids want to come in and work with somebody completely new, which is understandable. So there's a lot of, I guess, common questions that I get. So one of them is, can I practice more with my child? And it's like, yeah, you can. But what I would do is put a timestamp on it. So if you say, I'm going to practice this skill for the next 6 weeks, and then if I don't see any improvement, then come back and see me. Because if we think, oh, it's a lack of practice, then I think it's okay to give that a try first. If you think about how you were writing before, because you'd switched to your non-dominant hand, your other hand would have been compensating a little bit. So there would have been an element of biomechanical inefficiency there and a lack of stability. So practice will improve that to a certain point, but it may be that touching base with an OT will give you some exercises that will boost that quickly as well. I also get, why can my child perform a skill at home but not at school? And often this is an environmental difference. They come into school, there's 20 other kids, there's a lot going on, can be more interested in what's going on versus the task that's presented in front of them. Sometimes parents can be amazing at giving a lot of structure at home, but when that's taken away, the child is not performing the same at school. And so what that tells us is that that child responds really well to structure, and then we need to look at, can we put more in at school, or why do we need so much structure? Okay. I also get, I'm not sure whether my child really needs an OT referral and who can I talk to. So for me, a child doesn't come onto my caseload without me speaking to a parent first. So you'll call, my receptionist will say, right, take your name and number, Casey will give you a call back. And part of that reason is that I need to make sure that I'm the right person to treat you. And I think, you should be encouraged to go speak to whoever you are referred to. I think it's an important step to take, particularly if we're confused about what OT is. And as we've already discussed, what is available on the internet isn't always relevant to this type of setting, which is unfortunate and something that I personally would like to change. The other one I get is, I had the same issues as a child, and will my child grow out of it? Well, maybe, but the difference is that you're in a different educational setting than your child. The differences in terms of the difficulties that you have, you might have had it a little bit milder. Maybe your child is struggling, a little bit more, because we also respond differently to challenges. So again, we can monitor it for a period of time, but give it a timestamp. And if after that timestamp we're not seeing improvement, then I would definitely say we need to look at an assessment. Okay. We also get, in my home country, children are not expected to perform certain skills at school. Does my child need OT? And this is what we would call an environmental fit, So some of the common ones are around self-care, because, here we do have helpers, which is fantastic, but sometimes they can help too much. What happens is when you're doing things like self-feeding, right, you're developing the pronation that you need to be able to write later on. So you're developing your wrist and your forearm stability. And so most people don't realize this, that actually these dressing activities are quite important. It also looks at developing your organization skills, fine motor skills, in some cases more refined balance and postural control, and sequencing and planning as well. So what I say is that, right, that's okay, but because we're in this particular educational environment, what we need to do is see if we can make the demands at home a little bit more closely with what's at school, and then we can monitor from there to see whether we need further assessment or not. So I do believe in giving some leeway as well. And the other one is, will people find out my child was having therapy. For me, no, because of confidentiality. Okay, I cannot talk to anybody about a child that I'm treating without the parent permission. Whether you choose to discuss it with friends, and sometimes I encourage people to, because often you'll find, you have a friend whose child has had OT or a family member or something like that, and that can be quite comforting to talk about as well. There's also the Facebook groups that you can post anonymously, and then parents will give you feedback and their contact details too. So that's another good way to have that discussion if you want to. But if you don't want to, then no, because we're a private practice and service. Okay, so the early years, so early intervention. So research shows that early intervention is the most effective. And the reason is that when problems are picked up early, they're generally smaller, okay? As we get older, the tasks that we're expected to do get more complex. So for example, if a child is picked up at say 3 years of age because they've got a lack of stability in their pencil grip, they're not really drawing much, chances are that by the time they get to write, they're going to struggle with that if there's an issue at 3 years of age. Sometimes I get referrals for kids who are in year 1 that can't write the alphabet. Okay, so you're in year 1, you can't write the alphabet, everyone else is writing sentences, and then you're missing out on some key literacy points, like using capital letters and full stops, developing more complex things, literacy skills like spelling. So it has the knock-on effect that it's at the sacrifice of literacy skills. So remember when I was saying, if you have a skill weakness and you're putting so much effort into that, it has a trade-off. So something else is going to fall behind. So if a referral is made for a child that is 3, generally for me, you don't see me every week. You might come in and see me for a session. The parent is in there. I train you with what to do. I send you with a home program, and then you might come back 2 to 3 weeks later. And we keep monitoring, and the home program gets further and further away. And then sometimes after that, I never see the kids again, because what it does is it changes the direction of the developmental path, because we've plugged in that skill weakness when the children are quite young. So, and as I said, it will affect learning, even social skills and play skills as kids get older if we don't address these things when they're younger. And this is part of the reason why countries like Australia, the US, and the UK have brought it in as like a mandatory thing. They have mandatory screenings now, in the preschools to pick up kids that potentially have some learning challenges, and then they look at getting intervention in through the government. The relationship between achieving goals and there is a relationship between achieving goals and emotions. So if I go to school each day and I'm able to do these things, I'm going to want to do them. If I go to school each day and I'm really struggling, I don't want to do them. And this is a neurological process. So the part of our brain that is activated during goal achievement is the same for every task that we do. So some kids you meet and they are struggling in certain areas, but then they don't want to try any task that's new. So it kind of has this knock-on effect after a while. As I said, hyper-focus on one area results in sacrifice of another. And being overwhelmed affects what is called our autonomic nervous system. So we can feel like uncomfortable, we can feel challenged, we can feel unsafe. And then what happens is you get kids that want to leave the classroom. As I said, they might physically lash out, yell. Sometimes they might withdraw, but often it's the fight or flight response which is picked up. When I show you the pyramid of learning, the behavior is actually near the top, and there's all these other skills underneath that we need to look at. So the behavior is the thing that is picked up, and when it's treated behaviorally and it's not changing, that really tells us that we need to dig deeper and find out what's going on. Okay. So in terms of OTs, we want to figure out why the task or skill is challenging. And we can do that for any age. So some people treat, babies. I treat kids from 2 years old up until young adults at about 21 years of age. So that's quite a big age range. When I do that, I can set specific goals and I can track them. And this is the best way, it's the best way to do anything. We know that, whether it's education, whether it's wanting to get fit, this is the fastest route to go by. We use what's called a play-based and interest-based approach. And the reason is that for us to develop a skill, we need to be motivated by it, right? So if you come home and you're like, right, you need to work on your drawing, so you're going to sit for 20 minutes and draw each day, it's like being forced upon you, and it's being done under duress, and then you're regulating kind of out of fear and duress. And what happens is the attachment to that becomes quite negative, and in terms of skill development, it's going to be limited. If we use this other way where we're using a play-based approach and an interest-based approach, we motivate somebody or the child to want to engage in these activities, and then we tend to get a more robust skill development. Play is this area that I feel like is really probably under-recognized, because we all go, oh, play, they're just having fun. But actually it builds the foundation for so much, right? So when you play, you need to organize your environment. So there's your organization skills. You need to think about your postural control when you're moving around. You need to use your executive functioning skills. So I need to make decisions about things. I need to use my communication skills and my social skills. And when I start doing stories and narratives, I'm also using my sequencing planning, and I'm working on my pre-literacy skills as well. And so play is this really amazing tool for us to help kids. And I know it's very much in the curriculum here, but it's a very good intervention tool as well. And it needs to be interest-based because we're going to do things that we're interested in. Some kids can have a hyper interest that we need to look at expanding as well, but we always start with their actual interests. We need to have opportunities for what is called purposeful practice. So the general rule is we should be about 85% accurate when we do something. Okay, so there is room for error. If it's like below that, if it gets significantly below that and the failure rate is too high, then we're really not learning a lot. Okay, and so with OT, what we do is we find out what's going on. We drop the activity down until we get that accuracy rate, and we slowly build it back up. But we also work with parents and educators on that as well. And so for all of us, we need a just right challenge. So let's say if you wanted to learn how to run, if you wanted to run a marathon, and I just went, right, first session, you're going to do 20 Ks. And you'd all look at me and just go, no, right? Or if you'd be really sore afterwards, it would be a very dysfunctional form of practice because the challenge isn't quite right. So it's exactly the same. Line of thinking. We also have what's called neuroplasticity, which is our brain's ability to modify and change its structure, and activities can do that. Okay, so when we experience success, when we're practicing things in the way that our brain and body should be, when it's purposeful and we keep doing that, we're building those neurological pathways. Okay, and this is why OTs use activity practice to help kids, because it's supposed to be fun. And when you look at the age range that we're looking at from 2 to 6, it's very appropriate. But obviously we would not give a 2-year-old the same activity that I would give a 6-year-old. Okay, and in terms of session structure, often it's individual with a parent present. Sometimes I do run small groups for children that have self-regulation difficulties from 4 to 6, and that's in a pair. Or sometimes it'll be a home program where I show you the exercises, but you go home and practice them and come back. So there's all different forms. Some kids will see me for a few sessions. Sometimes it's a few months. Sometimes it's longer, depending on what their needs. But my ultimate goal is to educate parents, to help educators, and to have them exit with a set of strategies. Kids are not going to be perfect, but they should show a significant amount of improvement. Okay. So this is called the pyramid of learning. And so this is how OTs view how we acquire skills. So if you look at the top, we have academic learning, and we have cognition and intellect. Below that, we have daily living activities, which is like things like our self-care skills, and I'd also put play there, and we have behavior. Okay, so that behavioral piece is quite near the top of the pyramid. Now, as we discussed, if there's an issue, say, with a physical part, so let's say for you guys just then, I would say there's probably an issue with your postural adjustments when you're writing with your non-dominant hand. There would have been issues with your motor planning because it's harder. Possibly your proprioception, which is your body's position in space, and the tactile discrimination as well wasn't as fluent. So if I wanted you guys to improve with your handwriting, I would look at improving these skills to make the handwriting more fluent so you can access the academic learning at the top. Okay, so when we get a report that a child is, dysregulated in the classroom and they're struggling, the behavior is the thing that everybody sees, and it's my job to try and find out why that's occurring. Okay. So here we have some examples of intervention. So this little boy is quite interesting. So he started seeing me at 3 years of age. These are my drawings here, but these are his. So you can see how faint they are. And he was copying what I was doing because he loved animals. And my drawings are a little bit advanced for a 3-year-old, but we were just trying to get him interested in using a pencil, right? The after OT one was done about 2 weeks ago while he was waiting for me for a session, all on his own. So now his drawing skills are actually advanced for his age, and now he's starting to draw like stories and scenes. So he drew this, and then he could tell me what was happening. So that's quite a big difference.
How many sessions?
He's actually made quite a lot of improvement. So 9 months? Yeah. So not like around weekly, but in this case, there's always a family member in the session. And because of that, whatever I ask them to do, they go home and do it. So he's made a phenomenal amount of improvement. With this one, this was a 4-year-old. This was me here showing him what to do. But he really struggled with his pencil grip. So he came in with a Palmer like this. And the parents were concerned because then he was going to next level up, and I think it was prep, and he had to begin to write. So some of these drawings here are mine. The fainter ones are his. But before OT, he wasn't actually drawing at all. Okay, so he couldn't. So we got him up to the point where the parents were happy and the school was happy as well, and he started to draw more representations. This is one of my favorite ones. So this little girl came in, she had just turned 5. This was her drawing before OT. So this is her drawing. Apparently it's a jungle, but there's no clear shapes. There's no clear spatial organization there. And she looked like she also had some difficulties with executive functioning issues. She, after about 4 sessions, was doing this, drawing animals with a lot of detail in them. So not quite up to where we should be in terms of drawing scenes, but that's a dramatic difference that we helped her with. I've shown you drawing today because I can't show you my play because of confidentiality, and I thought this is the easiest way to show you what I do. Okay, this is a 6-year-old. When he first came to see me, you can see there's a lot of instability in the line, and actually it was really hard for him to be able to do a dot to dot there. After it would have been about 6 months worth of therapy, this is his drawing. Okay, and I know the fine motor is not the neatest, but at least now we want to draw and we want to color. And not only do we want to do that, we've actually become interested in writing as well. So this is my writing down here, and this is his up here. So that was a huge difference for this particular child. And then I've given you an older sample as well. This is a handwriting one. So this child, okay, so this one after OT, he was really into Minecraft, and so that's why we have Minecraft words. He doesn't actually know them, but we just wanted him to write something he was interested in. But this was his assessment piece. Okay, and so there's quite a big difference, and he was on a home program, so he did not see me every single week. Okay, so these are the different forms of intervention that we can have, and these are the outcomes that we generally see as well. Is there any questions at the moment? No? Okay, so COVID and child development. Now this one has been, I think, a really big piece recently, and I do get a lot of questions about it. So one thing to keep in mind is that there is research being done, but it is still being peer reviewed. So there are things that are being published, but I also, I think we should interpret it with caution as well, okay? Because the results don't sound so good. So in terms of motor skills, they're saying it's mainly the gross motor that has been affected, which really makes sense because we're all locked in apartments for a long time. And then, you couldn't do PE for a while. And then even when you could do PE, it was like with a mask on and things like that. So, it's not the easiest. Communication was the other one. And that partially depended, they think, on how much the caregiver was able to interact at home. So for parents, they're like trying to homeschool their kids and then getting on and working in the evenings. So it really changed the interaction dynamic, and the play skills was the other area that was less well developed as well. But again, not all kids had exposure or were able to come to groups, at school. These studies weren't done in Singapore, so I can't say that they're all completely relevant to here. We have got more referrals for things like gross motor, definitely. And again, I take that into consideration, and I might be like, right, yes, there are some difficulties here, but let's try a home program first and see how much we go with practice before we do sort of weekly therapy sessions. The other one that's often being brought up is fine motor, but it seems to have more to do with technology because there's a lot more technology use at home. And so what I say to parents is, if that's the case, try and get kids to do more around the house. So try and get them to be doing things like making sure they're dressing themselves, making sure they're helping out with certain chores, like even if they're doing things like helping washing the windows or washing the cars, those types of things, it is opportunity for practice in that area. It is functional, and sometimes it can be quite fun for them as well. So the other one, okay. What they also hypothesize is that home-based learning may have impacted some children with learning difficulties. And so actually we've had a lot of parents self-refer after HBR because they noticed that their child was having difficulties and they wanted to know how to help. So that's been a really big referral source. And the other one everyone's been talking about is the masks, and this is inconclusive. So when I did the research, some people were saying, oh yes, it is affecting, and then some people were saying no, because you still have a tone of voice, you can still see how somebody's moving their body. So not everything comes from facial expressions through the mouth. You also get expression through the eyes as well. So I think this one will take a little bit more time to sort out. But as I said, the thing to be really cautious of is the fact that this is a work in progress. If you are worried about something, then I would say start practicing, okay? At the end of this presentation, I've put down a whole bunch of resources that you can look at. So whether, like recently I've had consultations about organization skills and self-care skills. So I sat down with the parent and we went through what was expected at home, what was expected at school. There was a little bit of a mismatch there. 6 weeks later, the school's saying everything is good now. Okay, so sometimes it's just that consultation that helps. So try and practice any skills that have been highlighted. When you're doing things like motor skills, try and do playful things like where you're playing with them versus sending them to too many leisure classes. I know that that's always a good option, but leisure classes are not always driven by a child, and sometimes they cannot be developmentally completely appropriate as well. So getting out, learning how to climb a tree, learning how to run around a park teaches you how to use your body, teaches you how to balance, and it's not so structured as well, so this is important. You can consult resources, and as I said, I have some at the end of the presentation, but there's also lots of information available on the internet, or you can ask your teacher as well. And you can also ask for assistance. So if you and the teacher are not noticing improvements, then go and contact somebody like an OT, or if it's communication, I guess somebody like a speech therapist, so then you can consult with them. Because I said it's not always huge amounts of intervention that are needed. Sometimes it can just be a few sessions, or we do a bit of training with parents, so then you guys can go and implement these things at home. Okay? But it is important that we do plug these skills in early when it's identified, because as I said, without that, the gap tends to get a bit bigger. And if you think about it, with what you were doing before, when I asked you to write with your non-dominant hand and you're a bit like, and I know like I'm asking you to do it with your non-dominant hand, so I'm kind of setting you up a little bit. But that's what it's really like for some of the kids that I work with. Okay, and then as they get older, parents will say like they don't want to write, they don't want, like there's tantrums at home, I can't get them to do their homework, And so we have to put it into perspective that it might be easy for us, but for some reason there's a blockage there for them. Okay, are there any questions?